Okay, so I'm going to be explaining how to use an incentive spirometer and what it's for. So it's mainly used in pre-op and post-op patients to prevent atelectasis, and it mimics a natural sighing or yawning mechanism to encourage the patient to take slower, deeper breaths. For pre-op patients, so first thing I'm going to do is I'm going to wash my hands, sanitize my hands, do all that. I put on the proper infection control that is whatever is needed for that patient, whether it be gown and gloves or the full shebang, whatever that specific patient is required. Then I'm going to introduce myself to the patient and explain what the incentive spirometer is for and how to use it. So when I first go in, I'm going to measure their inspiratory capacity and their vital capacity to have to chart as their pre-op capacities. And then I'm going to explain the whole procedure to them, which I'm going to explain to them that they exhale normally and then put the mouthpiece in their mouth while either sitting up and holding the spirometer upright or sitting it on a table. Make sure they have a tight seal around the mouthpiece and instruct them to take a slow, deep breath and hold that for 5 to 10 seconds. Have them count to 10 to make sure that they hold it long enough, and then exhale normally, and explain to them that they need to repeat the procedure 6 to 10 times per hour, but leaving enough time to recuperate in between so they don't hyperventilate. And I'm going to chart whatever whatever their pre-op capacities are. But after I instruct them on how to use it, I'm going to have them explain it back to me and demonstrate it back to me so that I know that they understand it and that they know how to use it. Then, like I said, I'm going to chart down their initial capacities and their pre-op flows and volume achieved and things like that, so we have a baseline to go off of post-op. So when it comes to post-op patients, I'm going to do the same steps. I'm going to wash my hands, put on the proper PPE that is specific to that patient, introduce myself to them, and both times I'm going to check their wristband to make sure that I have the correct patient. But introduce myself to them again and make sure they know what the procedure's for and what it does. And then I'm going to explain the entire procedure to them again, even if they have already had it explained to them pre-op. I'm going to explain it again, which is just exhale normally, create a tight seal around the mouthpiece, inhale slowly and deeply, and then hold that 5 to 10 seconds, count to 10, however you want to word it, and then have them exhale normally and make sure they repeat it 6 to 10 times per hour, which, once again, having the correct amount of time to recuperate so they don't hyperventilate or anything like that. And because they are post-op patients, I'm going to explain to them how to splint their incision with a pillow. And then before I even do the incentive spirometer, before I explain it to them, before I have them demonstrate it back to me, I'm going to measure their heart rate, respiratory rate, and listen to their breath sounds. But I'm also going to look at their pain medication schedule, just so I kind of know what schedule they're on and how the patient's doing. And then explain the whole procedure to them, and then have them explain it back to me and demonstrate it to me. And when they demonstrate it to me, I'm going to measure their volume achieved. So if it's a volume-based device, I'm going to look at their maximum inspiratory effort. And if it's a flow device, I'm going to use a respirometer just to get that number and chart it. Then I'm going to have the patient cough, and I'm going to observe any sputum that is produced and make sure I add the notes to my chart of the sputum, the consistency, how much, color, whatever. Just make sure it's all in the chart. And I'm going to listen to the breath sounds again on the patient and chart the therapy and the instruction, and make sure that the numbers go in there correctly so that we can compare that back to the baseline that we got preoperatively, and make sure that way we can compare and make sure that the therapy is working.